I'm Solomon Barney. My friends and everybody else usually call me Saul, and I'm a harm reduction worker at the Warden Community Center in Scarborough. I was a Toronto police officer for 32 years in downtown Toronto, and in my career I had a lot of dealings with people with drug addictions, and unfortunately, I guess that's what the job called for. My job was enforcement. If somebody had a drug thing, then my job was to take them off the street and get them before the courts, I guess. And I never got to follow up. Never had that follow-up chance, because we were so busy and you go from one task to the next.
My name is Sunil Budai. We are at Warden Community Center. Providing substance users with the materials that they need, it primarily keeps them healthy, right? Keeping people healthy because we see addiction as a disease, they're going to use their substance no matter what, right? So because they're going to use their substance, we're going to say, we are going to keep you as safe as you can because you have this disease. This disease is like any other disease. It's like cancer. We're going to keep you as safe as we can possibly keep you by giving you this material so you don't contract HIV or any other STI. Instead of people disposing their needles in parks and places where other people might be, they dispose of them by returning them to us.
What we have is a chopstick. We have 2 glass pipes, 2 packages of brass wire screens, as you see here, a package of matches, alcohol swabs, and condoms. What they do is they take the screens, just to give you a quick idea here, they'll take the screens, they'll fold them, stick them into the end of the stem, they find a clean flat surface, take the chopstick and they'll flatten it down nice and tight, and then this becomes a filter. They take their piece of crack cocaine, they'll stick it at the end, use the matches, light it up, and then inhale through here to smoke through here. That's the inhalation kit, or the crack kit, or the smoker's kit. In this one, this is our injection kit, or needle kit, or points kit. They have different names for it. In here we have 5 needles. Okay. We have 5 metal, what they call cooking spoons. We have sterile water. Again, we have matches. We have a little package of vitamin C, alcohol swabs, cotton balls, condoms, and a tie, a rubber tie. We're not fueling an addiction. Most of the people we work with, they've been addicts for a long time, and some of the people we work with will be forever. They'll tell us flat out, I have no intention of quitting drugs. So if you're not going to quit, then at least let me give you the materials, the clean substance materials that you can do it cleanly. Instead of sharing a crack pipe with your friend or sharing a needle with a friend, let me give you clean needles so you got your own needles. Let me give your friend clean needles with their own needles. And that way we're preventing the spreading of diseases. And let's face it, if you got 3 people sharing a needle, if one guy's got a disease, they're all going to have it. They're all going to end up in emergency. Look at the strain on our healthcare system, right? I did have some clients quite some time ago. First, when I started here, I had some clients who said to me that they were getting hassled by the police because they were carrying the harm reduction materials, the smoker's pipes or the needles and stuff like that. And the officers were taking them away. Now, it's not against the law to have that stuff, So what I did, I took it up on myself, was I made some phone calls to some contacts in the police department. So I went to the police stations and I did a little 15, 20-minute talk about the harm reduction supplies and harm reduction materials, and so that the officers could be educated also. Because we had a lot of new officers who weren't familiar with it and didn't know. So I thought, you know what? We have to educate both sides. So educate them, then they know, and the clients know, and then they don't feel like they're being harassed or hassled by the police.
Because of my work experience as well, I've worked in a number of different agencies over the years. I can make referrals for clients pretty easily. Just if a client comes to me and finally says, I'm tired of using these substances, which happened just last week. A person came up to us and said that she was tired of using substances after 20 years of substance use. She's looking for treatment to get herself off this drug that she's using. So we were able to find a referral for her and refer her to a service that was able to give her the kind of care that she needs now, right? So we wait for clients to ask us for what they need, and we try our best to provide them with that.
We also help set them up in counseling if they require that. We will also help set them up in housing. And a lot of times we just become a listening ear. If there's something they want to talk about, we just talk to them about it and try and ease them as much as we can and make things easier for them. There's one, and I pretty much become friends with him. Actually, he's got a young family, also a really nice kid. You know, got into drug abuse by accident, basically, with friends and stuff, just as a social thing, partying, and then ended up in the street. I did work with him for quite some time. He eventually confided in me and said that he really wanted to beat the habit and he wanted to go into a program where he could beat it. So I made some phone calls and spoke to some contacts and got him into the residency program at CAMH, the Center for Addiction and Mental Health. 6-week program over there. Came out clean, and I'm proud to say he's been clean ever since. He's got a job, full-time job. Also, prior to him going into the program, or during the program and stuff, he had some court attendances, some court appearances that he had to attend to. And I went to court with him and as a character reference and supported him in court. And I'm proud to say I was able to keep him out of jail because he was looking at 2 years less a day in jail. And I was able to convince the Crown Attorney and the judge that you know, he was on the right path and I could assist him. And they believed me and let me work with him. And I told them flat out, you know, if you disappoint me and let me down, you're gonna end up in jail. And I'm proud to say that he's been real good for the last 2 years now, and I'm happy about that. And if I don't have another success story, this one's real good. The fact that I did for 32 years what I did gives me a little bit of experience and a little bit of something to draw on now when I work with clients here. And you know, I mean, I saw what they went through as a police officer. I saw what they went through, and now, of course, working with that, I can find ways to help them move along a little better, I think. Anyway, so my past experience certainly works in their benefit, I'd say.